New health concerns with the Johnson & Johnson vaccine have federal regulators recommending we suspend those shots till we know more. Across Arizona and the country, pharmacies, clinics, and shot sites are no longer using the J&J single-dose vaccine.
The concern here is over an extremely rare blood clot. It is about 1 in a million cases. They want to see if the clots are connected to the vaccine. The White House had a clear message for the public today. This should not be a major disruption to vaccination efforts across the country.
The J&J vaccine makes up less than 5% of the more than 190 million recorded shots in arms in the United States to date.
The timeline is somewhat unclear. The administration's looking at a pause of days or weeks, not months.
And it's important to keep this all in perspective. As Dr. Fauci said, these clots are incredibly rare after nearly 7 million J&J shots. We're seeing just 6 reports of blood clots we can't even be sure are connected yet. All 6 cases were women under 50. 1 died, another is in critical condition. We know you've got a lot of questions about the vaccine, so we went to the experts for some answers.
We have team coverage this evening. Max Gordon looked into what it means for the vaccination effort overall, but first, what about the people who've already received the J&J vaccine? There are around 120,000 of them in Arizona. Brittany Thomason has advice from health experts and also talked to some people who just got their shots. Brittany?
Some of them feel nervous with the latest news. Others think the pause on the brand is not a big deal. I think most people who got the Johnson & Johnson shot just want to know what this means for them. When it comes to vaccine brands, Tim Tregaboff once thought Johnson & Johnson was his #1 pick.
I was specifically seeking out that vaccine just for the ease of one and done.
You got the shot April 1st, only to learn today the FDA, CDC, and the state recommends a pause on that brand based on 6 people in the U.S. reporting blood clots after their Johnson & Johnson shot.
Hope it doesn't happen to me. I wouldn't have gotten the Johnson & Johnson. I would have gotten Moderna or Pfizer.
Dr. Mortaza Akhtar says the complication is extremely rare, but he understands why the news might feel scary for people.
I wouldn't get panicked about it if you've had the vaccine. As a matter of fact, my own brother was getting it a couple of days ago, and I myself, I'll be honest, I'm a human, began thinking, should he just wait?
Whether you got vaccinated or not, Dr. Akhtar says it's always a good idea to monitor blood clot symptoms.
For example, severe shortness of breath, significant chest pain or leg pain, severe headache. Those would be things to look out for.
Thankfully, Tregaboff has not experienced any of that.
It's been almost 2 weeks now and I haven't had anything arise yet, so I'll definitely be monitoring myself a little bit more.
In the 6 blood clot cases, the FDA says all the symptoms occurred between 6 and 13 days after vaccination. In the newsroom, Brittany Thomason, Arizona's Family.